Something that might help you understand some of how this works altogether is to consider what drugs have effects on the autonomic system. So I want to talk about a few different drugs here to give you an idea of how we can manipulate the system chemically, and it'll illustrate a little bit of what it does. Now, most of the drugs I want to consider are clinically relevant drugs. However, like addressing an elephant in the room, I think it's important to talk about nicotine. The nicotine receptor is found on all autonomic ganglia. Acetylcholine released from either preganglionic sympathetic fibers or preganglionic parasympathetic fibers are going to be activated by nicotine. Nicotine isn't really used clinically other than for smoking cessation, but it is used recreationally by a good number of people. So it's important to think about what nicotine does to the system. Clinically, it's important to think about the cardiovascular risks associated with smoking. And some of those risks extend beyond the autonomic system, but I want to talk about just the autonomic aspects of that. Now, if somebody's smoking, they're going to have nicotine in their system, and that nicotine is going to be free to bind with nicotinic receptors all over the body. Now, the main place that you're familiar with nicotinic receptors, you might not have talked about them in that way, but they are found at the neuromuscular junction. The effect on the neuromuscular junction is not that crucial to worry about, mostly because it's going to be a generalized effect, and so all nicotinic receptors at neuromuscular junctions are going to be activated, which is likely going to cause all the different muscles to contract. And for the most part, muscles have antagonists. So, for example, you'd activate the biceps brachii and the triceps brachii at the same time, and the net effect would be basically nothing. One thing you might need to consider, although I don't know this is a huge aspect of the risk factor, is the diaphragm is going to have neuromuscular junctions all throughout it. And so nicotine could potentially do something to the diaphragm. If the diaphragm is contracted too much by nicotine in the system, it might not be able to relax enough to allow normal breathing to take place. I'm not actually familiar if that's a big issue with smoking, but it is something to consider. But let's think about the autonomic system more. The nicotinic receptor is found on all ganglionic neurons, like I said. So it's going to non-specifically activate the autonomic system. The sympathetic and the parasympathetic sides are all going to be activated. For most things, that's not a huge deal because of the same reason I just mentioned for the biceps and triceps. The competing inputs are going to essentially cancel each other out. However, for the cardiovascular system, that's not really in effect. Most importantly, blood vessels are generally only under sympathetic system control, or at least blood vessel tone is strictly sympathetic. And so any increase in sympathetic activity is going to cause an increase in blood pressure, and there's not a competing parasympathetic input to offset that. Also, the heart is a little bit different from your average target organ in that it's intrinsically active. The heart beats on its own. What happens with the autonomic system is that it modulates that or regulates that. The heart would normally beat at about 100 beats per minute on its own. The autonomic system will either speed that up above 100 beats per minute, fight or flight, sympathetic type response, or slow it down, the parasympathetic resting heart rate response. The muscle fibers in the heart, when they're getting competing input from the two sides at the same time because nicotine's turned everything on, are going to potentially be thrown off by the situation because they don't quite know what to do. It's going to cause a few different competing things to happen, which might throw off the heart rhythm. It could cause arrhythmias. One problem that can be associated with arrhythmias is an increase in the possibility of stroke because clots could be thrown while the heart's beating irregularly. So that's a serious risk of nicotine on the heart. Also, nicotine is going to activate the adrenal glands. And again, there's not a parasympathetic side to that. The adrenal glands are activated and adrenaline or epinephrine is released all over. That's going to also cause an increase in blood pressure, and it's going to cause more rapid heart rate. And all of that's not good for cardiovascular health. So that's the problems with nicotine, specifically based on the autonomic inputs. There are other things having to do with respiratory function and that sort of thing, but that's not autonomic. That has to do with the effect of smoke on the tissues of the lung. This is a picture of a plant known as deadly nightshade, also sometimes referred to as belladonna. It belongs to a genus of plant called Atropa, and it's responsible for producing a chemical known as atropine. Now, deadly nightshade is hopefully a scary name, and the reason for that is that atropine is a sympathomimetic drug, which means that it's going to activate the adrenergic receptors the same way that adrenaline or epinephrine/norepinephrine would. The name deadly nightshade refers to the fact that ingesting the berries of this plant can be deadly. Atropine will activate the sympathetic side, essentially, and mainly will cause people to die of heart attack or something to that effect. The greatest threat, probably, of deadly nightshade is that children might notice it and think that the berries look something like blueberries or something, although they're a much darker shade, and decide to try them out. An atropine overdose can be quite a rapid response, and it can be a problem. But if the child is rushed to the emergency room and things are dealt with very quickly, the disaster can be averted. Now, the plant has an interesting history. As I said, it was also referred to as belladonna, which is actually referring to the fact that it had a cosmetic purpose at one time. By applying an extract from the belladonna plant, which essentially would contain atropine, directly to the surface of the eye, that would cause the pupil to dilate, just as it would during the fight or flight response. Now, that is cosmetic because a dilated pupil makes the eye appear to be larger. It's cosmetic, and nowadays we don't do this to accentuate the eyes, but rather use other aspects of eye makeup, but the intended effect is the same. By accentuating the size of the eye, that's going to make the person appear cuter, more attractive, something like that. Because of how the eyeball develops and the head develops in vertebrates, we are sort of hardwired to think of an organism with large eyes relative to the size of its head as being young and therefore requiring nurturing, and we have a sort of built-in response to that. We think it's cute. Think of puppies and kittens and that sort of thing. You know, human babies, of course, are going to have the same effect. As an organism grows, the eyeball does not get much larger than the size it is in the infant, but the head does certainly get larger, and that's going to create a different ratio in eye size to head size. Cosmetics can play on that by accentuating the eyes, making them appear like a bigger feature on the face. That's going to make this same sort of instinctual response possible, and it's going to lead to people thinking that the person using that cosmetic is attractive. The problem with using belladonna for that, of course, is that it does have the unfortunate side effect of causing death. So it has to be used appropriately, and it is certainly not used now for cosmetics because of the problem. And in fact, drugs that do cause pupillary dilation are not atropine. They're usually drugs that act by suppressing the parasympathetic constriction response and therefore allowing for the pupil to dilate. But historically, belladonna was used cosmetically to cause that to happen. To illustrate this idea of the difference in the size of the eyes being attractive, not just for puppies and kitties and babies, think of animation. It's common, especially for female characters, for the eyes to be drawn in an exaggerated size. Now, this picture comes from an artist that shares work through, I believe, the website DeviantArt. The artist did a series looking at Disney princesses and taking the original picture and then manipulating it, redrawing it with smaller eyes that are at the right ratio to the head for the age of a young woman. Just to give you an idea. If you're interested in this, like I said, I think it's on DeviantArt. I don't remember the artist's name directly. The link below the picture might take you to a article that can tell you where it came from originally. I don't recall offhand. But it's a common thing in animation. Again, cosmetics are going to try to make the same effect happen, and it does make us think of the larger eye to head ratio, if that's the mathematical way to say it, which is going to stimulate us to just think of that as being a more attractive person. And then finally, I just wanted to mention a few drugs together which all act on the adrenergic system. Now, atropine acts on the adrenergic system also. And as I just said, atropine would be considered a sympathomimetic drug. There are also sympatholytic drugs. Now, these three examples that I want to share here are of both classes. The first one, what's labeled as the inhaler, if you can read the label on that inhaler, it's the brand Primatene Mist, and that specifically is a sympathomimetic drug which will cause the airways to open. Now, it's used to treat somebody with asthma where the airways are inflamed and therefore the walls are thicker and air can't get through as much. So if the sympathetic system would cause dilation of those tubes, that's going to make air get in easier while somebody's having an asthmatic attack. Other inhalers use different types of drugs that act in a different way. So this Primatene Mist was used as an example because it is in fact the sympathomimetic drug. Now, the vasoconstrictor represented here, preparation H, is a hemorrhoid cream, but the active ingredient in it, the vasoconstrictor, is a sympathomimetic drug also, causing constriction of the blood vessels. This is going to help with hemorrhoids because hemorrhoids is inflammation of the tissue around the opening of the anus, and so by vasoconstricting blood vessels in that area, the inflammation will go down. The active ingredient can be used at other places. It's not necessarily only for anal application. You may have heard of an off-label recommendation for it, maybe from Sex and the City, where it can be used to make the bags under the eyes less puffy. Again, vasoconstrictors are going to keep the additional accumulation of fluid in the tissue down. And then finally, beta blockers represent the class of drugs which are called sympatholytic drugs, and obviously from the name they specifically block the beta adrenergic receptors. The picture here is not a great picture of what a synapse would look like, but it does represent the idea that something's blocking where the neurotransmitter will bind to receptors. And that's what it does. Beta blockers are used often for cardiac conditions or high blood pressure, and by counteracting the sympathetic control of those aspects, it'll keep things in the restful, more parasympathetic aspect of what's going on in the body.